So we're going to go ahead and show you how your healthcare professional may apply the VAC, and I'm going to show you a couple different things on this wound vac so that you kind of know what you're looking at. So this is an Activac from 3M. This is more of a to-go home vac. This is not something that you would get while you're in the hospital. The hospital one is called a VAC Ulta if it is still the 3M product. It's a little bit bigger than this, but the functions are about the same. So I'm going to go ahead and turn this on and let this load for a minute. Earlier I was talking about black sponge versus white sponge. So the black sponge is the one that you'll see, at least with the 3M Activac, the most, and this is what it looks like. It's porous and soft, and as I said, this is used as the primary dressing. If you have a tunnel or a tract, maybe some undermining, you may see this white sponge. And again, this is pre-moistened with saline and it's a little bit denser, so it has less tendency to tear off if we're concerned about something being in the wound that we can't see. Sometimes doctors or surgeons will also ask us to put this over any exposed tendons or muscles or bones. It is effective to do, but per the company it is an off-label use, so you might see that. Now, when your healthcare professional comes in to apply the negative pressure wound therapy, there are a couple of ways that they might do it. I'm going to show you today the way that is recommended by 3M on how to place the dressing. This is called VAC drape. Some nurses or other healthcare professionals may call it Tegaderm. It's very similar to Tegaderm, but it is called VAC drape. Now 3M advises us to create a window effect with the drape around the wound. And the reason for that is because this black sponge, as it is pulling drainage through it, will become moist. And we don't want this to be sitting on intact skin around the wound because it can macerate or dampen that tissue and then it can cause another wound. So we're going to go ahead and start windowing around the wound that we have here. And what I mean by window is really just trying to cut a series of these pieces of VAC drape, and so that we can make sure that we're protecting the peri-wound. If you do have to do this yourself, or if you ever have to patch a leak, sometimes these can leak. These have numbers on them that let you know which order to go in. So you're going to pull off the number 1 first, and then the striped side will go up. If you see a striped side, you realize that there is one more piece to take off. It should be totally clear. And so we're going to go ahead and take off the number 2 now. And then we'll just remove the tab at the end. Okay, so we've windowed all the way around the wound, and now the next thing that we'll do is cut the black sponge to fit directly into the wound bed. There are a couple different ways to do this. I'm doing it by eye right now, but we want to make sure that we have a good fit and that we're contacting all areas of the wound. I like to hold it up then, see how we did. Not too bad. That looks a little bit better now. And then the next thing that I'm going to do is I'm going to cover our dressing so that we have an airtight seal. Again, we're going to pull the 1. Now that our dressing is on there, I need to cut a hole in the VAC drape to allow the drainage to pass through and to hook up to the suction. Now this hole should be about the size of a quarter, or maybe a little larger. And then this is what's called the track pad. And this is where the suction will connect to the wound and it will bring the drainage back up into the canister. Now that we've hooked it up, we know we have a good seal all the way around. We're going to go ahead and turn on the unit. So these are all set to 125 millimeters of mercury of pressure. That's a factory setting that all of them come on. And the reason for that is because there's been a lot of research done that determined that 125 millimeters of mercury of pressure is just enough pressure to remove the drainage and stimulate the tissue to heal, while at the same time not being detrimental to healthy tissue. Now this can be changed. It can go up or down depending on the situation. For example, when we put a piece of white foam in, we have to increase it to 150 because of the density of this. We want to continue to pull drainage through the white. So we might increase it to 150 millimeters of mercury for that. And again, this is non-compressive pressure. This is a negative pressure, so it's pulling up, even though it might look like when we turn it on that it's pushing it down. Other situations where we might want to change the pressure might be if somebody has a lot of pain in the area. When we turn it on, we can turn it down also to 100 or 75 millimeters of mercury. Sometimes if patients have a graft underneath, or if they're on hospice and we're trying to maintain the wound and decrease our dressing changes, we can actually turn it down to 75 or so, just so that we're collecting drainage, but we're not putting them through these dressing changes every 2 or 3 days. And so I'm going to go ahead and turn the unit on. It might take a minute on the model, but it's starting to draw down now, and so you're seeing that negative pressure work. These home units will click. If there's a leak, there's nothing to worry about as long as the machine is not alarming. So when we look at the screen, we can see that the wheel is turning. We know that it's on. It is set to 125 millimeters of mercury of pressure. We have a full battery, and it appears to be that we have a good seal. Now, other alarms that might pop up would be if there is a leak. That would be if we've lost our airtight seal around the wound or at some point in the dressing. There also may be something called a low pressure alarm, and that's if there is some sort of partial blockage in the line, either some drainage that has stopped there, coagulated blood, if the tube is being pinched between the bed and the wall, or if one of these clamps is partially pushed down, that might create a partial blockage, and then it would say low pressure alert on the unit itself. If it says blockage, that means there's a complete blockage, and the dressing will either have to be removed, or you'll have to call your healthcare provider for instructions on how to deal with that. The battery on these is usually like 8 to 10 hours, sometimes upwards of 10 or 12. But as long as it is plugged in while you're sleeping, you should have almost a full day of charge. And again, it will alarm if the battery is low, and then after it goes past the battery low, it will go to battery critical, and that's usually, it'll alarm every 3 seconds for about 30 minutes, so you have a good amount of time to get it plugged in. And that's how the application of the wound vac works. Thanks for tuning in. I hope this was informative. If you have any specific questions, please follow the recommendations of your medical provider. If you do have a medical emergency, please call 911. If you found this video helpful, hit the subscribe button below for more wound care educational videos.